Welcome to Medixel Tuition Center. My name is Dr. Boniface Kasawe, and in this episode, I'm going to make you understand blood pressure. So, for us to understand blood pressure, we need to start with the physiology of blood pressure and how it's regulated. Then, after that, we'll go into the causes, risk factors, and the pathophysiology, including how we manage the blood pressure. So, when someone says your blood pressure is high, or when they say your blood pressure is, let's say, for example, 120/80, what do these numbers mean? So we have the top number, let's say 120/80. So this top number is the systolic blood pressure, and this bottom number is the diastolic blood pressure. So what do we mean by systolic and diastolic blood pressure? First, let's understand the definition of blood pressure. So, blood pressure is the force of blood pushing against the walls of our arteries as the heart pumps. So, we need to understand key terms like systole and diastole. So, let's look at the heart as the pump. A pump that has pipes which are blood vessels. So, when the heart pumps blood, we call that as systole. And when the heart relaxes, we call that as diastole. So what is systolic blood pressure? So systolic blood pressure is the maximum blood pressure during systole. It's the maximum blood pressure when the heart is contracting. This top number. Then the bottom number is known as the diastolic blood pressure, which is the minimum blood pressure during diastole. It is the minimum blood pressure when the heart is relaxing. So what is happening when the heart is relaxing? Let's understand this with the head of a diagram. So imagine this is the left ventricle, then this is the aorta, then we have a semilunar valve here. So when the heart is relaxing, meaning it's expanding, meaning this semilunar valve is going to close. In this case, this is the aortic valve. So when this valve closes, there's going to be some pressure in this aorta, and that minimum pressure in this aorta is what we are calling the diastolic blood pressure, which is equivalent to 80 millimeters of mercury. Then we have another type of blood pressure which is known as pulse pressure. So what is this pulse pressure? So the pulse pressure is just the difference between, pulse pressure is just the difference between the systolic blood pressure and the diastolic blood pressure. Then we also have what is known as the mean arterial pressure, the MAP. So this is the average blood pressure during the cardiac cycle, and it's mathematically described as diastolic blood pressure plus 1/3 of the pulse pressure, which is systolic blood pressure minus diastolic blood pressure. So this mean arterial pressure is very important because it is the determinant for tissue perfusion. So if this MAP is low, it means our tissues will suffer. especially the brain. So what is this average? What do we mean by average blood pressure during the cardiac cycle? So we know the duration of diastole is 0.5 seconds and the duration of systole is like 0.3 seconds. So it's not the mathematical average that we know in mathematics, but this mean arterial pressure is the average BP during the cardiac cycle, taking more of the diastolic blood pressure because the duration of diastolic blood pressure is more. That's why in other ways we can say the mean arterial pressure is equal to 2/3 of the diastolic blood pressure and 1/3 of the systolic blood pressure. So now let's now understand systolic and diastolic blood pressure. So for us to understand systolic blood pressure or diastolic, we need to understand their determinants. So the systolic blood pressure has three determinants, which is the stroke volume, which is the amount of blood that the heart ejects, and also the cardiac output, which is the amount of blood that the heart ejects per minute. Then it is also determined by the compliance of the aorta. So we can say systolic blood pressure is determined by the stroke volume and the cardiac output. So this same cardiac output can also be mathematically described as cardiac output is equal to stroke volume times the heart rate. Then this same systolic blood pressure is also determined by the compliance of the aorta. How compliant is the aorta? So this compliance is the stretchability of the aorta. How stretchable is the aorta? Is it compliant to the expansion of the blood that is coming into it? So stroke volume, cardiac output, and the compliance of the aorta, these are the main determinants of the systolic blood pressure. Then now, what are the determinants of the diastolic blood pressure, which is the minimum blood pressure during diastole? So the diastolic blood pressure is determined by the elastic recoil, of the aorta, and total peripheral resistance. So this elastic recoil is just when the aorta is expanding, how does it recoil back? When it's expanded, how does it recoil back? And the total peripheral resistance is the resistance of the resistance of so this is the resistance of the smaller blood vessels towards the blood flow. So this is how tight or narrow the small blood vessels are. So this is the total peripheral resistance.